So we are back, and I'm not coughing. All right, so now we have Ian Vasquez,
Yes.
and he is with MeMD. Welcome to the show.
Thank you, Carol.
All right.
Congratulations on 5 years.
Thank you very much. Now, Ian, I want you to tell everybody, this is a very interesting concept, so I want you to tell everybody what you do.
Okay, well, great. Well, you know, MeMD is a service that when I hear you coughing a little bit, it might actually be of use to you.
I need it.
Yeah, sometime soon. So MeMD is an internet healthcare service where today you can go on to the MeMD website and log in, create an account, and request a visit with a medical provider over the web. And instead of having to leave the home or drive to the doctor's office, you'll be able to do a video conference with a provider right there online, typically in less than 30 minutes. And they can
Listen up, guys. That's pretty cool. Nobody can get out anymore. It's perfect.
It's great, and in fact, it's very affordable compared to going to the regular doctor, and it saves you a lot of time and money, and is very convenient.
All right, now let's write this website down, which is MEMD. So it's MEMD.com.
That's correct.
Okay. Now the number to call, would they call them too?
Yes, you can call in, and our help staff will help you enter your visit online.
Okay, so the number to call them would be 855-MEMD-NOW. That's 855-636-3669. Now, I'm having everybody write that down right away because this is very interesting. You're going to want to hear what he has to say. It's new. It's different, right?
It is, but it's the same medical care that you would always received, but it's just using the internet now. It's, everything else has gone online. You can buy books online. You can, pay your taxes online. Why wouldn't you be able to go see the doctor online as well?
Well, that's an interesting thought. Where did the concept then come from?
I wish I could take credit for it myself, but it was actually created by Dr. John Schufeld. And now Dr. Schufeld is someone who 20 years ago pretty much started the urgent care industry and started one of the nation's largest urgent care chains. And 20 years later, he really saw that after he had developed this urgent care strategy to treat patients that were going to the ER and didn't necessarily need to be there, he really saw that there are a lot of patients that are going to the urgent care as well who really don't need to be there either.
Tell me about it. That's why you have so many long lines.
Exactly. Yeah. And so for things like the common cold like you might have, or the flu, seasonal allergies, sinus infections, various types of...
So it's not to go to the gynecologist.
Right. It's not a replacement for your primary care physician. But, for example, if you're on vacation and on that topic forgot your birth control pills and you needed to get a script, you could use MeMD for that service.
Oh, that's
not
perfect.
as a full replacement to your primary care provider or for women a gynecologist, but to help fill in the gaps and to help provide the solutions when you fall ill.
Right. I mean, that's happened to me when I was sick the other day. Thank God I knew a doc. I've had a few docs on the show. So now I have this information.
A lot of times that's the way we describe it. A lot of people have a friend that's a physician or a nurse practitioner, and when they get sick, they'll just call them on the phone and say, hey, here's what I've got. I know I've had this before. I had this prescription before and it worked. Can you call me in the script?
Yeah.
Exactly. So this is just a more formal way of doing that for all of those people. Most of us.
And not imposing on anyone, really.
Exactly. And again, at a very affordable rate compared to when you go to the doctor.
All right. So the number to call this is area code 855. That's MEMD now. MeMD now. Or you could go 855-636-3669. And that website is that's MEMD.com.
Right.
Okay. So, you've kind of been describing the kind of patients and what anyone really is a candidate.
Really, anyone is. But what we've seen is that this is typically something that is great for parents who are on the go, for example, who have a job. When your child gets sick,
in the middle of the night,
and you're working and you want to take them to the doctor, that typically for most people is going to mean you miss a whole day of work and all of that lost income, or maybe you can't afford to miss a day at work. And so this can be a great way that those parents can get their kids treated, more quickly quickly and in less time. Other folks as well, I mean, sometimes people have just been putting off care, that they have something that's been kind of nagging at them. They figure they'll just get by. And this, because they don't want to take all the drive time to go to the doctor and they don't want to spend all that money. People who are uninsured, this is great for as well.
Why? And say that why?
Well, just because
you
of
don't
the
have to have
affordability.
insurance.
Yeah, we don't require insurance. It's completely self-pay.
Wow.
It's one low price when you come in online and request a visit. And it's really one low price that's a low price. Even if you do have insurance, it's typically cheaper than your copay. And if you do not have insurance, it's certainly cheaper than going in and paying the self-pay rate at the physician's office.
I find them for you guys. This is a pretty interesting thing. Now, that website is MeMD.com. So it's me, like M-E, me, myself, and I, right?
Right.
MeMD.com. And that number to call is 855-636-3669. And that's 855-MeMD now. So that's kind of neat. And how long does the process take?
So typically the entire process takes 20 to 30 minutes or less. And what's involved in that is you go to the website, you create an account, and you enter some basic information about yourself. Those same forms that you would fill out when you go to the doctor, we have online versions of those where you fill out your medical history, your family medical history, and then your chief complaint today, like what you're sick with today, what symptoms you've been experiencing, etc. You'll then receive a call back from one of our care coordinator team who helps you set up your video conference and make sure that your webcam is working. This is something that you use a webcam in order to see the
So it's
provider.
like Skyping.
Exactly. It's a lot like Skype. Yep. And then after you pay for and request your visit, it's typically between 5 to 15 minutes that you'll be waiting for the provider to go show up on the other side of the exam. And so all in, it typically takes about 30 minutes or less.
Wow. And you've been saying it's very affordable. So how much does it cost?
It's $39.95 per visit, no membership fee or additional cost beyond that.
Hello. That's crazy.
Yeah. The typical average copay for people who do have insurance is somewhere between $50 to sometimes
Starts
up to
at 35 or 25, right?
Yeah. And for the ER, for example, a typical copay there is over $100. Now, if you drive in and you don't have insurance into the doctor, it's going to be much, much more than that.
How about doctors? What kind of doctors are on there?
Great question. They're actually the same doctors that you would drive in to see. So many urgent care practices, those same ones that you would drive in to see, we've signed them up in our network to be the recipients of these patients. And whenever their waiting room is not busy, they'll just pop over and do an exam on MeMD in the regular flow. So the same doctors that you're seeing otherwise.
I have a question.
Yes.
How do they take a temperature?
Well, all of that is actually self-reported information. So if you can take your own temperature, you have your own thermometer, you can just punch that into our website, and you let the physician know what your temperature was.
Okay. Mm-hmm. So how does it work? Let's say your child, you're just telling them the symptoms, right?
Mm-hmm,
and and you talk to an actual live, when you're doing it through the Skype, you're talking to a doctor.
Just like you would in the doctor's office. Yes, exactly.
For $39.95.
Yes.
And there's no other fee?
No other fee.
No other fee whatsoever. No membership fee?
No membership fee.
All right, guys, this is for you. Ready? MeMD. That's MEMD.com. And the number to call is area code 855-636-3699. And there's no insurance necessary. Let's talk about that again.
Right. So it's just you pay on the website. Now, if you do have insurance and you have one of those health savings accounts or flexible spending accounts that have a debit card attached to them, this is a qualified medical expense, and so you can use that card and use those pre-tax dollars that an HSA or an FSA account provide you.
So what's on the horizon for MeMD?
Well, there's actually really a lot of exciting things. One of the big ones is that in addition to offering this to the general public as we're doing, we're offering this as a solution to employers. So on the theme of networking amongst companies, We're offering this as a solution to employers where they can save on their overall healthcare costs by reducing the cost of their ER visits and urgent care visits that their employees go to, as well as providing a really great benefit to their employees that they'll really value and make good use of.
Wow. So how do they get implemented with that with you?
Same thing. They can go to our website as well. There's a form to fill out there, and they can call us as well to get signed up for the service.
Wow, this is very cool, and I can't believe it. I got to go up on the site and do it. So it's MEMD.com, and the phone number to call is area code 855-MEMD now. That's 855-636-3669. It's me, like me, MEMD.com.
Thanks, Carol.